welcome to FinTech Fun Talks. I'm Christy with Copper Campus Ads Agency, and we're happy to welcome our guest today, Lydia Moilanen. Lydia is the Director of Product Lifecycle. Lydia, welcome.
Hi, thank you.
We're so glad to have you here today. Can you give us a little bit of a background on yourself and your work history and where you are today?
Yeah, so I started in healthcare after undergrad. I actually started as a medical scribe and then joined the corporate team after a couple of years in that position and found that I just had a knack for program implementation. And so I was traveling around for a couple of years, starting these major staffing programs at huge health organizations across the US. After about 6 years, I left that company, had been promoted several times, and left the company as a director of implementation and learning development. And then kind of hopped over to a brand new startup company that was in the software as a service, and it was in the real estate industry. Worked there for about 6 months and helped them build out an implementation process specifically for customer onboarding. And then just found that I really missed being in the healthcare industry, and found that the mission of the company that I'm with now really aligned with my personal beliefs and my personal values. And so I was found by the current company that I work with through a peer that her and I worked together at a previous company, and came to the company, which is in healthcare, specifically in the FinTech side, and helped them start a launch team, and have grown exponentially in the last 3 years that I've been with that organization into now an entire product lifecycle team, which really focuses on company growth and scalability.
So we'll get into the product life cycle component a little bit here in a few minutes, but I wanted to talk to you about FinTech specifically and what brought you to that, or was there anything that brought you specifically into the FinTech world?
Yeah, I think I definitely didn't look at it from the perspective of joining FinTech, or that FinTech was particularly interesting to me.
Mhm, mhm.
But I wanted to be a part of system-wide change and really help individuals from at a large scale and not just one-to-one patient care. I definitely loved my clinical years when I was in that, but it felt like a drop in the bucket, and I wanted to make a bigger impact. And so joining the organization that I'm with now, instead of, one patient at a time seeing, 30-ish patients in a shift, we're now impacting millions of lives across the United States and helping them access much needed services, and focusing specifically on marginalized populations.
Oh, that's really cool. So, being in the line of work that you are in, you're looking kind of at a high level and implementing at a broad scale. And so, tell me what you have seen within these past few years of major growth that made the biggest difference in what you were able to implement and then seeing the biggest growth from that.
Is I think one of the benefits in coming into the position the way that I did is that nothing existed before I did. So I had a clean slate. There were no preconceived notions. There was no previous person that I was backfilling, really no expectations other than it's that startup scrappy environment. Whoever's available just does it. And they grew to a place where they recognize that, okay, now we need a process and we need to be able to do this over and over and over again. So coming into the position, there was obviously a lot of rapid learning, and being somewhat new to the fintech industry, a lot of new nuances that I wasn't used to. So at my previous organizations focused really primarily on new business and grow, 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 which is repeating the same thing over and over again. We're selling the same thing over and over again. But this organization doesn't do that. We pride ourselves on creating unique solutions that really solve the problems of our partners. And so I think in the last 3 years that I've been with this organization, we haven't sold the exact same thing twice. And I had to adjust my way of thinking and really think about, the processes and the things that I really learned to rely on early in my career, and see how they can be adapted or potentially thrown out the window and learn something new. And specifically being in the tech side, the the processes like Lean Six Sigma. I got my certification in that early on in my career. While they're immensely helpful for certain industries, certain organizations, they were really created in a time where there wasn't rapid growth with technology. And so those kind of methodologies are too rigid now for the tech world. And it's all about looking at learning from the past, looking at these things that have been successful in the past, but how can we adapt them in the future, or maybe take bits and pieces from different methodologies to really be successful and not be stuck in one particular position, one particular process, and create that ability to grow into the multiple areas that the company wants to grow. So a lot of learning for me personally, because I was very used to my process. I was very tied to Lean Six Sigma for a really long time, and I had seen significant success with that methodology, and kind of came in guns blazing, built a process, and it worked once. And then the next one, it was like, okay, we can't do the exact same thing. I need to do something different. And being able to still give that organization and kind of structure that wasn't there before I came, but with enough flexibility that we can really make a dedicated impact to the specific population and the specific customer that we're looking at, and we're not tied to kind of one specific rigid process.
Yeah, thank you. It's interesting, because a lot of these methodologies came out as a way to serve the most people in the quickest period of time, right?
Yeah.
Which is great, right? You're getting out to a lot of people, but you're the second person that I have talked to recently that has said that they're seeing these types of things go away and that it is becoming much more customized. And if I'm understanding you right, your underlying message with this is that you have had to come in and customize with each new project or delivery that you are assigned to. And that takes some flexibility. That takes some agility of mind. And you have to have a lot of knowledge of these various different modalities that you can use. And how do you find the adaptability of this with your developers, with your whole team from start to finish, from ideation to launch?
Yeah, well, change management is difficult in general. No
Yeah.
matter the organization, the position, people kind of get tied to their processes. And it's definitely not smooth sailing 100% of the time, but it's really about having an underlying relationship with each individual or each org within your company to understand what their biggest needs are, and make sure that you're able to meet their needs, be in the way that they think. So I will say one of the things that was really big and our executive team really pushed on me when I first started is building those relationships so that individuals know I'm not coming in and saying you need to do all of these things that I tell you because I told you to do it. It's understanding how they work, what is successful for them, what they're willing and not willing to adapt. And you'll find that in my experience, most of the time you'll find that you're able to get about 95% of that within your process. And the biggest challenge, I think, is learning new systems rather than a process. So our developers are going to receive information pretty much the same way, no matter what system you're in. They're going to have a ticket, they're going to build, they're going to comment, we're going to change the stage, we're going to QA, test. All of those things are going to be the same pretty much across any organization in the tech world. But the intake process going into that changes drastically depending on what we have sold. So it's still providing that level of assurance that you're going to get the details that you need in order to effectively do your job. But on the front end, my implementation specialists have to know how to react and adapt during those customer conversations to really understand what they need. One thing that's been a big shift in our thinking, particularly in this area, is focusing on outcomes, and being outcome driven and value driven. And it's really changed our way of understanding the need of the customer, because previously, a startup, you're kind of just taking whatever somebody wants and saying, yep, we'll do it because you want the business. And then you get to a point where you need to start making strategic decisions on what makes sense for you as an organization. organization, and what is going to grow and what's going to sell. And asking the customer, why do you want this? What will this solve for you? Rather than just taking it at face value. And we've found that in changing our line of thinking, we've been able to do a lot more for our customers with a lot less, and still meet their needs versus, oh, they said they want this particular page with these 5 things and they want to make it pink and green, and we just go and do it, and then they figure out actually those colors are not really great for this for this market or for this user. And pushing ourselves as the expert and being able to push the envelope and say, hey, we think this is what's going to be successful based off of our experience.
And that's, it's an amazing place to be because you are the subject matter experts, right? And having that pool of knowledge and people coming to you, it's like you said, they can come with a specific idea. They may have a solution in mind, but you have so much more information. You have seen what other people have implemented. You're able to take those bits and pieces and put them together and create a plan that's unique to them. And so it really puts you in a place of being a trusted advisor to these people.
Yeah, absolutely. Something.
So Lydia, you have been doing, for the past 5 years, you've been focused on sustainable growth. And I'm sure you have many lessons and many tips for people about that you have learned throughout this time. And so can you tell us a little bit about your approach?
Yeah, so whenever I break down sustainable growth, I look at it from 3 major pillars. I think about reliability, repeatability, and scalability. And I find that if you don't have those 3, it's not sustainable and the growth is not guaranteed. And so whenever I think about how to help an organization grow, it's creating enough structure around the scalability so that you can just continue to add more people, add more deals, add more products as you need, given the goals of the organization, but you still have a firm process to follow and everybody fully understands that. So within an implementation specifically, implementations don't drastically change across really any industry. You are doing some sort of intake, some sort of build, some sort of testing, training, and then going live. And so keeping everything geared into those major swim lanes really helps kind of center everyone around, and that you can pull bits and pieces as you need. One thing that I have learned later in my career is looking at things as components that you can plug into each other no matter what the particular need is. So how we approach our implementations and our launches today is what pieces, what components can make this particular thing successful. So rather than saying we've sold product A, it's saying, hey, we might have sold this back-end platform and we're going to tie it to this front end platform and it's going to have this user interface. And having those particular pieces, the components, be the repeatable and the reliable process. I'm going to build the front end interface that's been chosen the same way every time, but I may pair it with a different backend interface for the admin group that we're serving. So breaking it down into components provides that really reliability and repeatability that we need in order to reach that scalability. Obviously, that's easier said than done. It's not, just push of a button and here we go. There's a lot of code that goes into creating that kind of level, and it relies strong collaboration with our engineering and our product management teams. And I find that particular frame of thought really works no matter what you're in. So I'm heavily involved in a nonprofit organization outside of my work, and I run a hospital in Kenya, and I go every summer, and I think about it the exact same way. We want to see as many patients as we possibly can and help as many people as we possibly can. What's going to make us successful in doing that? And it's having an intake piece. So we have people sitting at the front who are doing the patient interviews and gathering the information. Then they're providing it back to the physicians so that they can see beforehand what the patient complaint is and start asking the correct line of questioning in order to provide a diagnosis and a treatment plan. And then it's taking them, while they're waiting to see the physician, we're doing their vitals so that they're not just sitting there. And it's that easy flow and thinking about the different components. And hey, the line for this is a lot longer than the line for this. So let's switch them around and let's adjust and get this information in a different way so that we can still maximize our impact within that area. So I found a lot of success with that line of thinking, and I think it requires a shift in your mind. For me, at least, it really did, because I was very tied again to my like Lean Six Sigma. We're going to do it the same way every single time, and you can still do it the same way every time, but you're breaking it down into those components, and the order of the components can change.
Picking different aspects of each component.
Yep.
So, thinking of this from a consumer or a patient's perspective, it just makes me smile because I think of when the many, many times that I've gone into a doctor's office or the hospital or whatever it may be, and you are just waiting, right? Because they get behind. You never know what patient issues are going to come up while they're in with a doctor. And so it's totally understandable why they get behind. However, knowing that you're taking a look at the whole picture and all the different components that need to happen and making sure that it's running smoothly no matter what, that just like to someone who is efficiency oriented, that just sounds amazing. So good job.
Yeah. I learned that early on, particularly when I was working through the staffing organizations, is one of the staffing models that I implemented was at a hospital that is a lean organization. And everything down to the timing of how they clean the linens is tied in to the entire process. So they look at as soon as the patient walks in the door, how are we maximizing their time and their experience, all the way to being checked out and turning the room over for the next patient. This is specifically in emergency medicine, but that really started my frame of mind of efficiency and cutting down waste. And a lot of times there's a thought that doing something more efficient means potentially cutting back quality. And that's not always the case. Sometimes it happens, especially if you don't have somebody within your organization focused on quality and focused on that experience. But it can be factored into the overall process. And what we found in these changes and what I observed, particularly working with that organization over a period of 6 months, is their patient satisfaction scores were significantly higher than any other hospital I stepped in, and they operated the quickest. The physician spent the least amount of time with the patient, and on paper, you would think there's going to be complaints because it's in and out, churning, but it was completely different because they focused really on the need of the individual, and that gave that level of attentiveness that a lot of patients feel are missing from today's healthcare industry.
That just sounds like a real win-win for both the patient and all of the employees, no matter if they are the medical staff or the administrative staff. It's helping everybody be more efficient.
Yep.
So
Absolutely.
while we're having this conversation, I'm wondering if there are specific points that are more difficult to get past than others while you're scaling. Is it a certain size? Is it certain milestones that people hit? And I'm asking this in reference to the companies that you have worked with and implemented these things with, as you have done that both as an employee and as a contractor.
Yeah, so I think probably the hardest point of growth in moving from a new phase, a startup company to a new phase to a sustainable growth organization is this concept of what we have termed at our organization of making the turn. Um, and that is really focused on, okay, we're no longer accepting everything at face value. We're not saying yes to everything. We are putting processes in place. We are creating that repeatability. And what I find is that creates a lot of unrest internally, primarily because you hire individuals for a startup organization who are scrappy, who are going to see a problem, jump into it, and figure it out as they go. And that's what you need. But as you move to scalability, you don't have the flexibility to create that technical debt that you're okay with as a startup organization.
Right.
And that takes away autonomy sometimes. And there are individuals who don't do well with that transition. So within my career, I've told everybody, like, hey, there may come a time where your personal career goals and the company's goals are no longer on the same path. And if that happens, like, let's have a conversation when you reach that point. Maybe there's a different area that you might find more fulfilling, or maybe it's finding you success in a different organization. But it's really understanding the strengths and weaknesses of those individuals and looking at where are they going to be most successful, and are they driven to actually help this company grow, or do they really want that level of autonomy that they're used to? I also find that the individuals who want a lot of autonomy, not all of them are good with autonomy. So I think, this is said widely, and I'm sure there's someone very wise who said it, whose name I don't know, but your biggest asset as an organization is your people. And if your people aren't motivated by the mission, then they're not motivated to do their best. And getting everybody aligned in, hey, the goal of an organization is to grow. Like, the bigger, particularly in the industry that we're in, the bigger we grow, the more lives we have impact in. And that is providing services and helping marginalized populations that previously didn't have this access to this or opportunity to this. And so when you align everyone around the mission and you say, hey, it's going to cause unrest. Let's just talk about the elephant in the room. We're not going to say that this is great, everything's peachy, we're going to be great. It's calling attention to it, saying this is where we're at as an organization, and here's what we need to move forward. And I find that at some organizations, they don't talk about the vision. They don't talk about what the next 18 months is going to look like, or what we want it to look like. And in the organizations that I've been in where they do talk about it, I've seen much greater success because everybody is motivated to get to that place. And those individuals, like I said, who are used to the autonomy and are potentially that autonomy has been taken away, they're usually more competitive, in my opinion. And so they're seeing that from those eyes of saying, I really want to be a part of this. I want to make this happen, and I want to do it in a shorter time frame than what we've initially anticipated, because they have that competitive drive and you've signed them on to the mission, and you're saying, like, hey, we're all in this together, and it takes every single one of us pushing as hard as we can every single day for us to get there.
You. Let's talk about those underserved markets and communities that you've mentioned. What are some of the recent changes that you have seen happen for good?
Yeah. So I think one thing that's particularly interesting in the industry that I work in today is the population that we primarily target is elder adults. And they are particularly a marginalized population. And you have this rapid, ever growing world of technology, but you have a population who's not great at using technology.
Want to, right? That's what I
Exactly. Yeah.
find. Like we don't
I
even
hear
want to
that.
try.
I hear that a lot as
And I
well.
know I'll get there too someday. So I'm not throwing any shade.
Yeah. But the technology gives us the ability to impact more lives. So it's really struggling between those two things. And one thing that I have grown in over my career is learning how to hold two truths at the same time.
Yeah.
So
Okay.
it's not black and white. This thing can be true and this thing can be true. And how can you marry those together for the success of the individual? And maybe it's explaining, like, hey, we know that you don't want to get on your smartphone, but if you get on your smartphone, that means you can access this at any time, anywhere. You don't have to go home, get on your computer. You don't have to call, sit on a line, wait for somebody to answer and put in this order for you. You have it right at your fingertips, and let's teach you how to do it. And providing them the resources and showing them how it benefits them is one challenge that'll continue as long as we continue to work in this with this population. So I think that's one area of success that I've seen is really not slowing the growth and the progress of the technology, but also really focusing on the end user and making sure that it's going to work well for them and that you're providing the resources that they need in order to be successful with that thing.
I find that to be mostly education based, right? Like in my head, I imagine maybe there's this big scary technology in front of me. It's going to be hard to learn, but then someone shows it to you and you realize, oh, it's actually pretty easy. I can do this. If I do it once or twice, it's stuck in my head. I can do this. So that's kind of how I look at it. And I wonder if education is the answer from your perspective with this specific subset.
Yeah. I'm hesitant to say it's the answer because
Okay, yeah.
I don't think a one answer will solve anything. It will
Mhm.
solve anything. But I do think it's part of the solution. I think another area is accessibility,
Okay.
right? So like yes, making it available on a smartphone will help a lot of people, but we have individuals who are blind or hard of hearing, and we have to be able to adapt and provide them the resources that they need to be able to have the same access that everybody else has. So I do think like education is a big piece of it, and you don't want to release something into the marketplace and not teach anybody how to use it because then it's just going to sit there. They're going to say, I don't know what this thing is, and walk away from it. Also making sure that it's accessible to the individuals. So again, for this particular population, making the text larger
Yeah.
than you would see on a regular website. The products that we're offering within our marketplace, really targeting what these individuals need for their health. Specifically, what we focus on is what is going to keep them in home longer.
That's
And I'll explain a little bit of why I'm
yeah,
interested
I'd
in
like
that.
to. Yeah.
Because have worked on both sides of healthcare. Most of my career was spent in emergency medicine, but I have worked in 37 medical specialties. So I've seen a wide array of patient care. And this is the one and only instance I have seen in which the goal of the individual and the goal of the insurance company are the same.
Like,
Yeah.
especially for this group who maybe their voice is not as heard, to have those two groups be on the same page is so great.
Yeah. So an individual staying in home longer is obviously better for their overall well being, provided that they are in a safe environment and they have what they need. But them moving to a facility is going to be by far and large the biggest expenditure for any both Medicare plan, long term care, insurance, any of the other different industries or different types of plans. And I'm going through this with my grandmother right now. Actually, moved into assisted living, and that was a really difficult battle to overcome. And seeing the challenges of her navigating Medicaid and Medicare and all of those different things really gave me a fresh perspective because I am not I am not partaking of this yet. My parents are not at the age where they're partaking of this yet, though they're close. But I wanted to see firsthand her experience and see how like she had to move into assisted living because it was no longer safe for her in the apartment that she was in because she had fallen 4 times within a period of 6 months.
Yeah,
And
and that's so hard on the body. Like
yeah,
recovering and bouncing back from that is not
yeah.
easy.
And being just economically where she's at, it's an apartment. So she doesn't have the ability to build a ramp or to add these
Yeah.
different grab bars or these things that you may be able to do when you live in a house that you own. And so you have to look at each individual and see what's going to be successful for them. And ultimately, their success is a lot less money that the insurance company or the plan is spending on that individual. And I find that really interesting because you just don't see that in any other part of healthcare.
It's true. It feels like people are at odds in a lot of ways. So I just love to hear that. And then you having this happen in your own family right now, where you're seeing your grandma struggle and not only maybe financially, but also physically and her body hurting. But I imagine the mental strain of having to leave the home that you have a lot of memories in and that you maybe raised kids in or whatever it was, you've got your community there. That's a big challenge too. And now you can kind of go and take the things that you learned from this experience with your grandma and implement change
Mhm.
within your sphere of influence.
Yeah, I've found it really helpful just to give me a fresh perspective, because being where I'm at in the organization, I'm not on the front lines. So I'm not seeing those things like I saw when I was doing the one that was managing the projects earlier on in my career. And it really helped kind of just re-solidify what we're doing and why we're doing it. And it really highlights that the needs of every individual are different. So if you have family caregivers that are nearby and can come over, then we have things where we're giving the caregivers resources, right? So what makes it easier for them to provide the needed care that for their senior to stay in home? We have also aspects of maybe they don't have family members close by or at all that can take care of them. We can match them with a caregiver who comes into their home and provides that care, who helps take them to their doctor's appointments, who helps run errands for them. We have meals that be delivered for different dietary restrictions so they don't have to worry about cooking. There's a wide array of things that we offer, and it's all centered around the individual's needs and how can we keep them in home longer. It's much better, obviously, for their mental well-being, but it's providing that also that layer of safety that they need in order to be able to stay in home and not transition to a facility.
I love that. And I know the people in my life who are at an older stage, that's their goal as well. That's what they want to do. That's where their comfort is. And so seeing programs in place like this that enable that and help that is really inspiring. I appreciate all the information that you have shared, and I know that this is going to be helpful and inspirational to a lot of people. So, Lydia, before we end, is there anything, any last minute thoughts or advice that you want to share on sustainable growth, healthcare, anything along those lines?
Hmm. I'm sure there's a million
I
things.
know, right? Just one.
I'm a long-winded person, so I could talk about it for days.
You're good. Take as much time as you want.
But I think probably the biggest thing that has helped me be successful in my position is never be afraid to learn. And I've found that when you get to a certain level in an organization at a leadership stage, that learning tends to lessen and you're not adapting as much, and it's sad. I'm an individual who really likes to learn new things all the time, and I wouldn't be successful and I wouldn't be where I am today if I hadn't had that hunger to learn. So I think not being afraid to learn and take it upon yourself to teach yourself. Don't wait for somebody to teach you. We have so many tools today like ChatGPT and other things that can give you much more accessibility to resources than we've previously had when I started. So don't be afraid to learn, be hungry, and, keep running.
Excellent. That's great advice. Thank you so much, Lydia. We appreciate your time today. Thank you.
Thank you for having me.
Thanks for watching our podcast today. I'm Kristen. I'm the owner of Copper Canvas Ads Agency and the host of FinTech Fun Talks. Copper Canvas Ads Agency is a growth partner helping FinTech companies grow and scale their business within a 12-month period. I've been in the industry for over 20 years, and I've seen how saturated this market is and how difficult it can be to make your solution stand out in a really crowded market. And so that is what we are here to do, to partner with you, understand where your gaps are, and help create a plan to fill those gaps and really help you increase your growth and your revenue in that 12-month period. If you're interested, please go to our website, coppercanvasadsagency.com, and you can book a call to speak with me right there on the website. And I look forward to talking to you soon.